And in a way, the voice needs to be rehabilitated, exercised back into fitness in a way, a bit like the body does. When we're not well, we don't do our exercises so much because we feel a bit weak. And sometimes it can be that someone's had a long-term voice issue or infection, so they just haven't voiced for a while, and it needs to be slightly trained back into full action. But sometimes it's just that it gets into this position of falling back, as I call it, into the larynx like this. And this feels actually quite soft and relaxing to the person. It's actually better to use the voice a bit more dynamically than that. It doesn't really work to use it in a very constrained way, at least not for full voicing. There's certain situations where that voice would be okay, but to get a voice to be able to be flexible and get louder and just be able to do more to last for a day at work, for example, it really needs to be used in a way that isn't limiting it. And that sometimes is just a legacy of not being well and the voice getting a little bit constrained and a little bit held back. And it feels sometimes safer to the person to slightly restrict their voice. But in the long run, it really needs to be rehabilitated back. And it can be a very quick intervention with a professional to do that.